I'm so proud to be part of the Covenant organization. The thing that stands out for me the most is our people. The way that they show up for us and for our patients and residents is something really inspiring. I just want to say thank you to our teams. Our people are incredible. And as an organization, we've worked really hard to invest in our people, starting with our leaders. This year, we hosted over 400 of our leaders for a series of core communications workshops where we really dug into what it means to be a leader in Covenant and what it means to lead from your values. And it was truly amazing.
One project or one initiative that really stands out for me, it's our Covenant Wellness Community and Phase 1, the Community Health Center, which we are now just ready to open the doors on. They started off with a small vision. It was the Grey Nuns Hospital is a great hospital. It doesn't have the capacity to meet the demands for services. So the facility was built 35 years ago when the population was probably a quarter of what it is today that it's trying to serve. We set out on a journey to say, rather than a major capital upgrade, actually get creative about what could we move out of that hospital and locate in the community and integrate into the community, therefore freeing up the much needed space in the Grey Nuns for an emergency expansion. So proud to say we accomplished that, but we accomplished a lot more in the process. So it not only has a great economic model and a great cost avoidance of capital model, but it's an integration into the community to meet all of the community needs. It really creates that one-stop healthcare shop. I like to quote the Premier who says, all roads shouldn't lead to the hospital. Our belief is all roads will lead to the Covenant Wellness Community.
One of the moments that really stand out for me is the fact that we were able to do the groundbreaking in Trochu. This new development will really impact people's lives. We know it is a difficult transition for people if they need to go somewhere else. This will allow them to stay longer, age in place. We keep them together as a family because that connection to the community, connection to the family is really what adds value and quality to people's lives.
Well, honestly, within the last year, there's a few things that have stood out. One of them would really be the first year of operations of the new emergency department at the Misericordia. We've been able to look after more patients in a much better environment. It's really challenging for the staff to work in these very small, outdated environments. And now we've gone from that to what's considered state-of-the-art for emergency departments. Compassion is really what we've always been about in Covenant Health, and that really centers how we look at both our staff and our patients. And when we're embracing innovation and looking at these new areas to provide clinically excellent care, we're not just looking at what's new and cool, the latest widget that's out there, but we're looking at how do we provide an impact to patients. And that's how you really merge compassion and clinical care with innovation.
Well, what really stands out for me from the past year certainly is the transition in the leadership of the board. That is myself taking over as board chair from Ed Stelmach. That's been challenging and daunting, but also very rewarding. And I'm so grateful for the support of Ed because he's stayed around to kind of hold my hand from time to time, but also the support of the board. What makes me the most proud is how seamless the transition has been. And I think we remain true to our values, true to our mission, and that's really important. We know what those guiding principles are, and we just keep following them. So I'm kind of proud of the board and the way everyone's come together to make sure that we're really focused on what's really a new era in healthcare in Alberta. Covenant is ready for it.